If it's Wednesday, Robert F. Kennedy Jr., President Trump's pick to run the Department of Health and Human Services, gets grilled on his vaccine skepticism, some of his controversial public health theories, and his changing views on abortion. Plus, the Trump administration's surprise move to scrap a freeze on federal aid just a day after moving to implement it, amid intensifying backlash from Democrats and confusion in government agencies. And the Pentagon pulls the security detail for Trump adversary General Mark Milley and weighs a potential demotion in military rank for the former chairman of the Joint Chiefs of Staff. Welcome to Meet the Press Now. I'm Kristen Welker in Washington, where Robert F. Kennedy Jr. faced off with senators today in the first of two confirmation hearings to be HHS secretary. Lawmakers on both sides of the aisle pressed him on his well-established record as a vaccine skeptic and a pro-choice Democrat. Kennedy also fielded questions about his ability to lead HHS, a sprawling department of more than 80,000 employees and 13 divisions, including critical public health agencies like the CDC, FDA, NIH, Medicare, and Medicaid services. In his opening statement and throughout his testimony, Kennedy said he was not anti-vaccine, which led to some really testy exchanges with Senate Democrats who brought up his frequent past public statements expressing doubts about vaccine safety.
News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety, and I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science.
Now, Democrats also pressed him on some of his unsubstantiated claims about genetic engineering of diseases.
Mr. Kennedy, did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH-published study.
Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
And that's what the developer of
I
Lyme
want all
disease
of our
said.
colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death.
Now, senators on both sides of the aisle asked Kennedy about his past support for abortion rights, with the Republicans securing a commitment that he will support President Trump's anti-abortion agenda, and Democrats pressing him about his sudden evolution on the issue.
I agree with President Trump that every abortion is a tragedy. I agree with him that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with him that the states should control abortion. President Trump has told me that he wants to end late-term abortions, and he wants to protect conscience exemptions, and that he wants to end federal funding for abortions here or abroad. That's Title 10. I serve at the pleasure of the president. I'm going to implement his policies.
You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it.
Kennedy's testimony today comes as his cousin Caroline Kennedy is publicly urging lawmakers to reject his nomination, calling him a, quote, predator who preys on the desperation of families.
It's no surprise that he keeps birds of prey as pets, because Bobby himself is a predator. He's always been charismatic, able to attract others through the strength of his personality, his willingness to take risks and break the rules. I watch his younger brothers and cousins follow him down the path of drug addiction. Today, while he may encourage a younger generation to attend AA meetings, Bobby is addicted to attention and power. Bobby preys on the desperation of parents of sick children, vaccinating his own kids while building a following hypocritically discouraging other parents from vaccinating theirs.
Joining me now to break all of today's developments down is NBC News Chief Capitol Hill correspondent Ryan Nobles, NBC News senior reporter Brandy Zadrozny, NBC News health and medical reporter Berkeley Lovelace, and Dr. Amish Adalja, senior scholar at Johns Hopkins Center for Health Security. Thanks to all of you for starting us off. Ryan, let me go to you first. You were there for all of the action, all of the drama that unfolded today. What do you think? I mean, we played a lot of really testy exchanges. What were the biggest takeaways for you today, Ryan?
Well, it certainly seemed, Kristen, that Robert F. Kennedy Jr. was trying to find a place where he wouldn't have to completely abandon his long-held beliefs and the controversial statements and positions that he's taken over the course of his years as a healthcare policy advocate, in positioning himself in a way that he doesn't completely abandon those positions, but finds it a way to put them in a context that's a little bit more comfortable for a small group of Senate Republicans that may be considering abandoning ship and standing up to Donald Trump on this. He certainly is creating a bit of revisionist history in the way he describes his efforts around vaccines, saying that he's never been anti-vaccine, that he just wants to look at the science behind it, when there's a clear record of him being very hostile to vaccines, questioning and being a true skeptic to them, up to the point where it's led certain communities to consider whether or not vaccine use is appropriate. But again, as Chris says, we always talk in these confirmation hearings, there's probably a lot of Americans that watched the hearing that maybe thought it was a rocky performance and have a lot of questions about him being the next Health and Human Services Secretary. But it's not made for this group. It's made for that 5 or 6 House Republicans that may consider voting no. And I think while we played a lot of those highlights of the testy exchanges between Kennedy and senators, which I think are important, I think the most important exchange was between him and Bill Cassidy, the physician from Louisiana, who is a strong proponent of vaccines, who actually asked him some very pointed policy questions about how he's going to administer Medicare and Medicaid, the differences between the two programs. And Kennedy seemed to be a little bit lost about the specifics of that. And I think Cassidy's probably concerned about his ability to administer the responsibilities of being the Health and Human Services Secretary. And he's got to get to a place where he feels comfortable before he's ready to vote yes.
Ryan, let me follow up with you on that point. Do you have any reason to believe, because we know Pete Hegseth had a really uphill battle as well, and it hinged on one senator. How was Tom Tillis going to vote? Ultimately, he voted yes. Do you have any indication that at this point RFK Jr. does not have enough votes to get confirmed?
I think you need to start at a place of, yes, they will get confirmed, and work your way back when it comes to these Trump nominees and the way that they interface with Senate Republicans. Senate Republicans have continued to follow a pattern throughout this confirmation process after Matt Gaetz exited the stage. They do a lot of talking behind the scenes. They raise questions. They raise concerns. They say that they're worried about these nominees. But when push comes to shove and they're forced to be held accountable, they almost all fall in line. Now, I could give you the names of 4, 5, maybe 6 Republican senators who I think have real reservations about Robert F. Kennedy Jr. I have a list of 0 right now of Senate Republicans who have come forward and said that they are definitive no votes. Could he potentially stumble tomorrow as well and get into a point where he does not meet the threshold for confirmation? That is not out of the realm of possibility. But, Kristen, at this point in the process, I still say it's very unlikely. He will probably become the next Secretary of Health and Human Services.
Yeah, I mean, the last point you make is the critical one, that so far no one is outwardly saying they're a no vote. It's such an important point to emphasize. Ryan, let me ask you, obviously, those statements by Caroline Kennedy got so much attention, publicly calling her cousin a predator. What's the reaction been there on Capitol Hill?
There really hasn't been a reaction, Kristen. You know, I think that Caroline Kennedy is a very famous person. The Kennedy family still holds a very important place in American history and in American culture. I think that's part of the reason that Bobby Kennedy finds himself in this position of being the next Health and Human Services Secretary. But again, this isn't a hearing designed to convince a wide range of Americans. It's a hearing designed to just convince 100 senators to vote yes or no on a nominee. And I think that group of senators that may be waffling are really not that concerned about Caroline Kennedy and her opinion of this situation. They know that the Kennedy family doesn't feel comfortable with Robert F. Kennedy Jr. in this position. It's really more about his policy positions and whether or not they think he's up to the job. All right.
Thank you so much, Ryan. Let me head over to Brandy now. So let's talk about some of what we heard in terms of his stance on vaccines. He's made a number of public statements expressing skepticism, and yet today he tried to convince everyone that, yes, he would support vaccines. What did you make of some of those exchanges, Brandy?
Today was a bizarro world. I've followed Kennedy for the last decade, and I've heard him make dozens and dozens, hundreds of statements maligning vaccines, saying that they caused widespread injury and death, saying that they're dangerous. He said in 2020 that he regretted getting his own children vaccinated. He said, if only I could take that back, I would do anything. I would pay anything to take it back. He believes that vaccines caused all of his children's allergies. He said in 2021, when Charlie Kirk asked him, if you had to do it today, would you get them vaccinated? He said, no, I would never get any kid vaccinated. Again in 2021, when he was on a Health Freedom podcast, they said, you know, what should we do about everybody? Nobody likes anti-vaxxers. And he said during the pandemic, our time to come out is now. And he said, quote, our job is to resist and to talk about it with everybody. If you're walking down the street, and I do this now myself, if I see somebody on a hiking trail carrying a little baby, I say to him, better not get him vaccinated. And he heard that from me. And if he hears it from 10 other people, maybe he won't do it. You know, maybe he will save that child. So to say that he's a vaccine skeptic is just not really representative of what he's said over the last 20 years. He is anti-vaccine. It may be uncomfortable when someone says, no, I'm not, but he is. There's no other way to go about it. And so, you know, he says that he's not today. It was a total reversal, not just on 1 or 2 vaccines, but he said today to Senator Warren, Senator, I support vaccines. I support the childhood schedule. I've never heard anything like that from Kennedy in the past. It's a complete reversal. And so the question is, you know, what his supporters were filling the room from the group Children's Health Defense. The executive director was there. There were followers and supporters there from Children's Health Defense and from other anti-vaccine groups. And when I reached out to them today and said, this is new. What do you think about this? It seems to me that they might know that he might not really mean it. Someone said to me, we know where he stands and we're not bothered by those comments. So
fascinating insight, Brandy. Thank you for that look back, which, as you say, you have been covering him so closely. So it's really critical to look back on those comments and those anecdotes that you shared. Berkeley, let me turn to you. What were some of your takeaways from the hearing today, particularly as it relates to how he might oversee this sprawling agency of HHS?
Yeah, so there were a lot of things that were unclear before that kind of were made a little bit more clear. So, for example, Kennedy made comments about the bird flu crisis before. It was really unclear whether or not the Trump administration would devote resources to the bird flu crisis. And so Kennedy said that he would devote resources to the outbreak for that, as well as he would also support the Inflation Reduction Act's Medicare drug pricing negotiation provision as well. And so before, it was unclear whether or not they would support that. And then on top of that, I did notice he did seem to stumble a lot about health insurance and Medicaid. So on Medicaid, he did say that a lot of people don't support Medicaid, or people who don't like coverage don't support it, although polling suggests that a lot of people, actually an overwhelmingly majority of Americans, do like Medicaid. He also kind of fumbled a bit about the specifics of it. He said people on Medicaid have too high of premiums, but although people on Medicaid don't pay premiums, I'm thinking he probably meant referring to Medicare as well. He also said people don't like the Obamacare premiums as well. And so it's a little bit more clear on his regards to stances on health insurance, but he did seem to stumble a bit about it.
And we had a little trouble with your mic. We got it fixed. Thank you for hanging in there through that, powering through it. What did we learn about his stance on health care costs today? Because obviously that's been such a big focus, a big topic of conversation. The Affordable Care Act, should it be repealed and replaced? What did you think we learned?
It's a mixed bag. I think the biggest news was that the Trump administration supports the Inflation Reduction Act Medicare drug pricing negotiation provision, and so there's a little bit unclear whether or not they would support that and whether or not they would try to repeal it, similar to Trump's stance on the Affordable Care Act. And so they did say they support that, and right now they're in an ongoing negotiations with it. They're currently negotiating 15 drugs on that as well. He did seem to side with Trump on Obamacare. He said that Obamacare is increasingly unpopular, which polling suggests that's not true at all, that people do like their Obamacare coverage. So we could see in this incoming administration, if Kennedy is confirmed, him trying to move to try to weaken that law, which is something similar that happened in the first Trump administration. So there are some concerns there. And of course, there are ongoing lawsuits as well to try to get certain provisions as well removed for ACA.
Well, it's a really important perspective. And when I interviewed President Trump, he basically said, if I can replace Obamacare with something better, he would be open to that. But to your point, public polling shows how popular it is. A lot of Republicans say it's not realistic. Berkeley, thank you so much for being here. Really appreciate it. Dr. Adalgio, let me turn to you now as a doctor and as a public health expert. What were your key takeaways from today's hearing?
He's basically trying to rewrite reality and try and make his views more palatable, that he's just a vaccine skeptic that just wants more safety data, when that's not been his record. This is a person who said he wanted to erect a statue to the person who debunked the person that linked autism with vaccines. He wanted to have an Andrew Wakefield statue erected. So this isn't something that anybody should believe. I think this is just him wanting to get confirmed. And he really is what I would call a destroyer of health. He's got this nihilistic fixed idea that vaccines are harmful, and I think it would be a disaster for him to be in charge of HHS. And I wasn't convinced of any of this, and I think nobody should be convinced. This is just someone trying to get into a position of power to create more chaos and destruction.
You know, I'm curious what you make about his comments when he was pressed on COVID. He said that the U.S. had worse outcomes of COVID than other countries because of chronic disease and food quality. Can you just give us the fact check on that? Is there any credence to that? What do you make of that?
Certainly, COVID-19 synergizes with diseases like diabetes, hypertension, and obesity. And the U.S. does have a problem with all three of those conditions. And that does make COVID-19 worse. And that's part of the reason why we had worse outcomes in other countries that don't have as much of that. But a lot of our outcomes had to do with mismanagement from the government from the very beginning. Basically, there was evasion by the Trump administration for January, February, half of March before they started to do things, and they started doing the wrong things. And that's why we had such bad outcomes. But yes, it definitely did synergize. But I don't think that RFK Jr. is someone that's going to guide us out of these chronic disease epidemics that we have, because he doesn't even believe in the scientific method, and it's only science that's going to solve these problems, not his platitudes.
So, Dr. Dalsha, he obviously one of the biggest questions is what we've been talking about throughout this segment, his views on vaccines. He says he'll stick to the science, just as you're saying, when it comes to vaccines. What should people take from that, given his past statements in which he's clearly tried to link vaccines with autism, which, again, study after study shows there is no link?
He is an unprincipled person that's basically lying. I think there's no other way to put it. That he's lying about his past statements. He's lying about what he's tried to do for vaccines. I think that people should just dismiss it. This isn't the Robert Kennedy that we've seen for the last several decades. This isn't the Robert Kennedy who's made millions of dollars with the anti-vaccine movement. This is a totally different person who wants to be confirmed and is trying to say something that will sway some senators that might be on the fence about voting for him to think it's okay to vote for him. But nobody should be fooled. This is a destroyer. This is someone who is against one of the technologies that humans have invented that have allowed us to flourish, that have added decades to all of our lives and saved hundreds of millions of people. He is against that. If you're against that, you cannot be, a good person at heart. You are what Carolyn Kennedy said, a predator, if you were going to be against a life-giving technology like vaccines.
Let me ask you, broadly speaking, about a slightly different matter, which is that President Trump last week ended cooperation between the CDC and the WHO, the World Health Organization. What are the potential implications of that here, but also globally?
The biggest implication is that the U.S. will get information on a lag. We won't have situational awareness of infectious disease emergencies that are occurring all over the world. People report their outbreaks to the WHO, not to the CDC. So if we're trying to be resilient in the United States to infectious disease outbreaks, we have to be part of the WHO. And while there definitely are reforms that need to happen at the WHO, there's no way that those are going to happen unless the U.S. is at the table. So I think this is the wrong decision, and it makes us less safe, and it only increases the chances of infectious disease outbreaks spiraling out of control if the U.S. is not part of this.
All right, Dr. Amish Adalja, thank you so much for your insights. We do really appreciate it. We also want to tell you about some breaking news that we're following. It's tied to Capitol Hill. Just moments ago, former New Jersey Democratic Senator Bob Menendez was sentenced to 11 years in prison following his conviction for a years-long bribery and corruption scheme that included him accepting bribes of cash and gold bars. Bribes of cash and gold bars. Menendez was found guilty in July of extortion, conspiracy, obstruction of justice, and acting as a foreign agent to benefit the government of Egypt and Qatar. Coming up, a major 180 from the Trump administration as it rescinds a freeze on federal aid amid a flurry of questions and objections. Plus, President Trump signs his first immigration bill into law and announces plans to house migrants at Guantanamo Bay as he offers buyouts for all federal employees. Stay with us. You're watching Meet the Press Now. Welcome back. This afternoon, the Office of Management and Budget announced it was rescinding its memo ordering a freeze on some federal aid less than a day after it was put into effect and then put on hold by a federal judge. But today's move has created continued confusion, with the press secretary on social media suggesting the administration is still pursuing some kind of a freeze on federal aid if it is not in line with the president's executive orders. Now, all of this comes as President Trump signed the first law of his second term, the Laken Riley Act, which aims to clamp down on undocumented immigrants who commit nonviolent crimes. Additionally, the Trump administration is stripping more than 600,000 Venezuelans of their temporary protected status, meaning they can now be deported. And finally, the administration is ramping up its efforts to overhaul the federal government, offering buyouts to nearly all federal workers, a move the president spoke about just today. Look.
We think a very substantial number of people will not show up to work, and therefore our government will get smaller and more efficient, and that's what we've been looking to do for many, many decades.
Joining us now is senior White House correspondent Kelly O'Donnell. Kelly, thanks so much for being here. Boy, another incredibly frenetic day at the White House. So let's start with this rescinding yesterday's memo, which basically froze federal aid. Where does that stand, and what is the clarification, Kelly?
Well, Kristen, good to be with you. And by rescinding the memo, the Trump administration stops the court intervening, which a court did, put an injunction, expanded the time, and by rescinding it, that negates that, and they, one could infer, don't want to have to be in the court system about this. So they pulled that off the table, and what they're saying is there are executive orders that the president has signed, many that he has signed, and within that large group, there are some that explicitly said there would be freezes on federal funding to states in certain areas. When you think about things like diversity, equity, and inclusion programs, what they like to call woke ideology, transgender care, different things like that, that really fall into those cultural priorities for the Trump administration, other executive orders that they say still have an effect. It is unclear to us exactly how that will all play out, but what is very clear is that the broad intentions of the Trump administration to tamp down on some of the spending where it does not agree with the priorities, that will try to go forward in different ways that they can do it. So this is more of a tactical move to rescind the memo, not a change of their intentions.
Such an important clarification, Kelly. Thank you for that. Let's talk about the other big news today, the president signing the Laken Riley Act into law. As I just announced, that essentially allows authorities to be able to detain those who have been accused of committing nonviolent crimes. But in the middle of giving a speech about that, he basically announced plans for a detention center at Guantanamo Bay to hold migrants. What more can you tell us about this?
Well, it was a stunning update because there was no advance of the president's remarks alerting us to the fact that he would make this announcement. And very often, aides and advisors who have read the speech in advance give us a heads up so that we are prepared to talk about these issues and to pursue them. So President Trump is saying that Guantanamo Bay, the facilities that have been used for typically terrorism suspects who've been held for long-term detention. It's been a very controversial place. And you recall on the first day of the Obama administration, he said he wanted to close Guantanamo Bay. It still exists. It has been greatly reduced in numbers in that category of detainees. President Trump saying use that facility as a place to house migrants who are captured and detained in these enforcement operations that are happening around the country. A lot of questions about this. Our colleagues were able to talk briefly to Tom Homan, the border czar, Kristi Noem, the Secretary of Homeland Security, to ask them about it a short time after the event. And Mr. Homan says ICE will manage this facility. Secretary Noem said, and when asked about what it would cost, she said they're still working that out. So it had an on-the-fly quality to it as a policy proposal. There's still a lot more to be understood about how they would use that. We know that there is a question of a need for capacity for housing migrants if they're detained and being relocated. And perhaps this is how Mr. Homan is going to go forward. President says Guantanamo's available. Let's try to use it. And we're going to try to find out more about what that would look like and how it would work.
I know it'll be one of the key focuses there in the days and weeks ahead, Kelly. Just finally, the administration giving all federal employees the option, return to work full-time in person or take a buyout. What's the thinking behind that and the strategy behind that?
Well, they want to reduce the federal workforce. They specifically also want to reduce those workers in the civil service in offices all around the country who do not agree with President Trump's policies and his views about the government. So it talks about wanting loyal employees. Typically, civil service employees don't have any specific loyalty other than constitutional requirements to a president. It's not a political job. So they're hoping to reduce the workforce. There are lawmakers who say the authorization to pay them a severance package is not in the law. So here again, an idea put forward, lots of questions about how it would be implemented.
Yeah, it seems to be a theme with all three issues we talked about. Kelly O'Donnell covering every single angle for us at the White House, as always. Marathon runner that you are. Thank you, Kelly O. Appreciate it. Coming up next, we'll have a live report from the Pentagon after the newly confirmed Secretary of Defense Pete Hegseth announced a series of actions targeting the former chairman of the Joint Chiefs of Staff, who President Trump excoriated during his campaign, at one point suggesting he deserved the death penalty. We'll delve into that with Courtney Cubie. Stay with us. You're watching Meet the Press Now. Welcome back. In one of his first moves since being sworn in to lead the Pentagon, Defense Secretary Pete Hegseth revoked the security clearance and security detail of former chairman of the Joint Chiefs of Staff, Mark Milley. He also ordered a review of whether the retired general's rank should be reevaluated. In addition, 2 portraits of General Milley were removed from the walls of the Pentagon. Officials wouldn't say what was behind those decisions. Milley, who served as chairman of the Joint Chiefs during President Trump's first term, has clashed with Mr. Trump, and in anticipation of potential retaliation, he was included in a slew of preemptive pardons issued by former President Biden in his final days in office. Joining me now to discuss all of this is Courtney Kube from the Pentagon, our Pentagon correspondent. Court, thanks so much for being here. So what's the reaction been inside the DOD to this move by Secretary Hegseth?
Surprise, in a word. It's definitely been a lot of surprise. I mean, and remember, Kristen, that first portrait that you mentioned, which is the chairman of the Joint Chiefs portrait for General Mark Milley, that was actually removed on day 1. We still don't know who actually ordered that, but it was before Secretary Hegseth was even confirmed or sworn into the job. Now, that happened on day 1, but just yesterday, late last night, we found out that, in fact, Secretary Hegseth, one of his first moves on day 1 at the Pentagon was to inform General Milley that he was revoking his security detail, revoking his security clearance, and as you mentioned, he was directing the Department of Defense Inspector General to conduct an inquiry into Milley's time as a general officer to determine whether he has served in grade in a way that was appropriate for where he retired. He retired as a 4-star general. The OIG, the Office of Inspector General, keep in mind, Kristen, the IG was one of those who was fired late Friday night, so there's an acting there right now. But the Inspector General will provide some sort of a recommendation that could ultimately lead to a review of a grade determination board. So a group of Milley's peers, for all intents and purposes, could ultimately look at his time as a 4-star general and could decide that maybe he should be bumped down in rank. It would impact his retirement pay that he would have for life, Kristen. So this could have a big impact on General Mark Milley. I will say this is not a quick process, neither the IG's office nor a grade determination board, so I don't expect this to happen very quickly. But the security detail and the clearance, that will be much faster, Kristen.
It's just really a stunning set of developments there at the Pentagon, which of course echo what we're seeing across all government agencies. Court, thank you so much for joining us with that really critical information. We appreciate it. After the break, I'll talk to one of the Senate Democrats who questioned RFK Jr. today about where he stands on a number of public health issues amid an intense and combative confirmation hearing for the president's pick to run HHS. Stay with us. You're watching Meet the Press Now. Welcome back. As we mentioned, Robert F. Kennedy had his first of 2 days of Senate hearings as President Trump's nominee to lead the Department of Health and Human Services. Let's get right to one of the senators who questioned Mr. Kennedy today. Joining me now is New Mexico Senator Ray Luján, who questioned Kennedy as a member of the Senate Finance Committee today. Senator Luján, thank you so much for joining us. Really appreciate it.
It's an honor to be with you today. Thanks for having me.
Well, it's an honor to have you here. Let's start with one of the big topics. Mr. Kennedy today saying he is not anti-vaccine. Of course, a lot of people have noted that goes against a number of public statements that he has made. Do you believe him when he says he's not anti-vaccine?
Kristen, through all the questions that were asked today, what was clear is that podcast after podcast, recording after recording, and book after book that Kennedy himself wrote, it's all clear. He is not for vaccines, against vaccines, has made the argument over and over again, and he's profited, made millions and millions of dollars off of this position as well. So, look, that's just one of the questions that I think had both Republicans and Democratic members of the United States Senate puzzled today.
I want to play some of your exchange with Mr. Kennedy today. Get your reaction on the other side.
Yes or no, do you support cutting Medicaid or reducing, and especially in an area where you and I spoke about with the federal investment in Medicaid, which is known as FMAP? I'm going to call it a restroom break.
President Trump has not told me that he wants to cut Medicaid. He's told me to make it better.
Do you support cutting, yes or no? Let me ask you this way, since it's only about President
I support
Trump.
making it better, Senator.
If President Trump asks you to cut Medicaid, will you do it?
Oh, it's not up to me to cut Medicaid. It would be up to Congress.
Senator, what did you make of his answers? Were they satisfactory to you? Was that what you were looking for?
Absolutely not satisfactory. What was clear is he was trying to evade the question, number one. When my Republican colleagues would ask a question or two, it seemed like he had a straight answer, knew the policy. But what was clear today, whether it was this hearing or other hearings, from Mr. Kennedy himself saying President Trump said to do this or not to do this. What's clear along the lines of one of my colleagues asking him questions, that he's just going to be a rubber stamp here today. And it's not hard to say that if you support Medicaid as a program to deliver health care to millions of people across America, that the answer is simply no, you will not cut it. But he couldn't muster the strength or the courage to do that. It was very unfortunate.
So just to be very clear, it sounds like you're a no vote for Mr. Kennedy?
Look, I'm doing my best to stay open-minded to all of these folks today, but this hearing today, not giving clear answers to members of the United States Senate, whether it's asking about vaccines or Medicaid or other programs itself, not being able to answer simple questions about the responsibility to be the top United States health official as the Secretary of Health and Human Service is very, very concerning. And as of right now, where I'm sitting waiting for more questions to be answered, I certainly am leaning no.
Very quickly, do you think he has enough votes to get confirmed right now? Do you have a sense of it?
You know, it doesn't seem to me right now that he has or does not have the votes based on some of the questions that were being asked today. And one thing that I'm good at is counting votes. And right now, I can't count the votes that get him over the top. We'll see what happens between now and the time that he gets to the floor.
All right, we will see what happens indeed. Let me get your reaction very quickly. President Trump had this, frankly, surprise announcement that his administration is planning to put some of the migrants that they detained who are undocumented at Guantanamo Bay, at Gitmo. What was your reaction to hearing that? Is it realistic? What do you think?
This is the first of hearing that. One, I would say it's very, very concerning. Right now, even if you talk to the people that President Trump has appointed in this particular space, Mr. Holman and others, they're saying that they don't have enough money to carry out this nonsense that they're carrying out today. How are they going to even be able to do this, being that the cost alone of going to even look at Guantanamo Bay, you know, the one thing that President Trump should do to Guantanamo Bay is just close it.
You know, the White House is also revoking TPS authorization to hundreds of thousands of Venezuelan migrants who did have legal protection and work permits under the Biden administration. These are folks who followed the rules at the time. They're now at risk of deportation. It will probably get tied up in the courts, but what was your reaction to this?
So many of my colleagues here in Washington, D.C., Democrats and Republicans, we've all been asking to fix a broken immigration system. One of the legal pathways to immigration in America is using TPS, which is a tool that Democratic and Republican presidents have both used. As a matter of fact, President Trump used TPS the last month that he was in office during his first term. This just doesn't make any sense associated with what we're seeing from Holman, not only looking at targeting TPS, but now going into churches and schools. Democrats want to work with Republicans to fix this broken immigration system, to provide support for border security investments as well. But what we're seeing coming from this administration should concern so many people. And remember, it was this president that brought us separating kids from their families as well. And I'm terrified what we're going to see coming up in the next few weeks, the next few months.
Speaking of working with Republicans, let me ask you, 12 of your Senate colleagues, including your neighboring state's Senator Ruben Gallego, voted for the Laken Riley Act. President Trump signed that into law today, of course. They appear to have seen this as an opportunity to address some of the concerns that voters say they have about issues at the border. Why didn't you? You voted no.
Well, look, I'm not going to speak for my colleagues' votes. They can speak for themselves. I voted no against this piece of legislation because of concerns of what it ultimately would do. This is going to take resources away from other officials that have responsibility for going after criminals. There's a question of what beds would even have to be made available if someone was detained for stealing gum, for example, if someone that was being held and incarcerated for murder or for rape, if they would have to be let out in order to make room for them. This bill, as written, does not make any sense. As a matter of fact, Democrats were asking for amendments on this particular piece of legislation. So, one, we may not be able to fix it entirely, but you could make it work a little bit better. And our Republican colleagues were more about the politics than they were about the policy. Just as when Donald Trump called on our Republican colleagues as a candidate to take down a bipartisan agreement which would have been one of the toughest border security bills in the history of the United States, using social media, Donald Trump told Republicans vote it down, and they voted it down. They just fell in line. That's no way to fix a broken immigration system in America.
All right. Senator Ben Ray Luján, thank you. Please come back soon. We really appreciate it.
Thank you for having me.
Still to come, it's been a major week of executive orders, confirmation hearings, government upheaval, and White House confusion. And it's only Wednesday. We'll dig into all the politics. The panel's next. You're watching Meet the Press Now. Welcome back. Let's get right to the panel. Joining me now is Kevin Fry, Washington correspondent for New York One, former Maryland Democratic Congresswoman Donna Edwards. She is also an NBC News contributor, and Republican strategist Matt Gorman. Thanks to all of you for being here. So this is another incredibly busy week for the Trump administration. Let's start with this spending freeze. It's been a little confusing. They sent out a memo basically halting federal aid and spending on some of these key organizations, and then they reversed. There was a legal intervention, and now they're basically rescinding the memo. That's a legal maneuver, according to our Kelly O'Donnell. What do you make of it?
Yeah, but at the same time, I mean, look, the Democrats have really found an issue finally after about a week and a half of what are they doing? What are they focusing on? They have one now. And Senator Schumer has been having now daily events about this to try to pound Republicans in the White House for their handling of this. He today was citing the fact that he was getting calls from nonprofits, from organizations back home, from Republican local officials who were calling his office saying, what the heck do we do about our infrastructure investments and other things, that projects that we're working on back home? So they believe that they finally have an issue after kind of receiving plenty of criticism that they weren't necessarily latching on to one issue and coming up with one strategy to combat the White House. They seem to have at least found their first one.
It's a really great point, Matt. And what we're seeing, I mean, in watching this all unfold, some people are saying, you know, Trump got off to a very quick start in terms of signing executive orders, laying out his policy agenda. And then this felt a little bit like the first Trump administration, putting out a policy, rolling it back, getting the backlash, and then, you know, reacting to that.
The hallmark of the first 10 days was really precise and precision in his all executive orders and everything it did. It had a very clear plan through a host of them. This was the first one that felt very vague. And I think it allowed a vacuum to form among Democrats that they could really pile onto this, because even a lot of Republicans weren't really clear. And one note I took note of, Dave McCormick, right, the new senator from Pennsylvania, kind of almost took credit. He's like, we heard a lot of input from Pennsylvanians about this. And so that was a little bit telling to me, but you're right. This was the first one where there was a vagueness to it that allowed Democrats to latch on to.
Yeah, well, speaking of which, Donna, this is what Hakeem Jeffries posted. He said, round one goes to Team America. We remain in the ring until far-right extremism has been completely and totally knocked out. So again, to this point that Kevin raises, Democrats are trying to find their messaging and footing. They've latched on to this. But what do you make of it? They're not quite out of the wilderness yet, to put it mildly.
No, but I do think that what happened here is that this had a real-world impact. I mean, most federal payments are made by an electronic payment system. That all stopped. And that is what resulted in calls from community health plans and nonprofits and, you know, a whole slew of organizations and government entities. And so it was an easy one in some ways for Democrats to grab because it had a very tangible impact on people's lives.
Yeah.
And it also plays into the messaging that Democrats had certainly been leaning into in the last couple of weeks, which is that we are the party that's looking out and actually care about trying to bring down prices, whereas the Trump White House is all distracted. You can argue whether or not that's accurate, but at least that fits into their paradigm that they've been operating on.
Matt, the urgency for them to bring down prices, there's been so much focus. He's only been in office a few days, but The timeline, I mean, they must feel that urgency to actually be able to show some work.
I don't think yet. I think Democrats have tried playing this gotcha game, taking pictures of egg prices, you know, with 5 days in. I think it misses a point a little bit as suddenly people now are blaming now Trump for the price. I don't think it's that. I think you'll start to see as we go into the spring, and as there's a bill, whether it's, you know, energy, taxes, that will, I think, start to kind of crystallize a lot of this happening right now. But I'm not that worried about that political concern quite yet.
Well, you take me to my next point, which is that Republicans had a retreat. They talked about their agenda. How were they going to get it through? This is what House Speaker Johnson had to say. Take a look.
We believe that we are going to engage now in what can be one of the greatest pieces of legislation in the history of the United States Congress, because it will be so consequential, because we have to fix everything. And we have a mandate from the people to do so.
Kevin, obviously, Speaker Johnson, President Trump, they want this big, beautiful bill, which President Trump describes it as basically lumping everything together, the border, taxes. What are you hearing about how realistic it is to actually get that through?
Well, I mean, we'll start with, it's not even clear that they still have settled on what exactly the plan is going forward. Is it one bill, or is it two bills, or is it, I mean, and what goes in these bills? And do you lump in the debt ceiling? That's probably a non-starter because of some of the Republicans that would need to get on board to pass the thing writ large. The bottom line is, whichever route they plan to take, which Trump arguably isn't really helping because he's kind of keeping the door open to two bills, even if he says he wants the one big, beautiful bill. The bottom line is, the Republicans all have to be in line behind this. There is no margin for error. They might pick up, you know, 1 or 2 more seats in the next couple months once some of those special elections go through, but that's still basically a paper-thin majority. And because there are different coalitions in the Republican caucus, be it the SALT caucus that wants to deal with state and local tax deductions, mainly in states like New York and California that help deliver them the majority, or if you look at the more conservative Freedom caucus that's going to balk if they're not sufficient cuts for them, there's a very fine line for Speaker Johnson to walk here.
There really is. Matt, how do you see it unfolding? What are you hearing about where they're leaning? I mean, it seems like he was arguing for this one big bill.
You're absolutely right. They almost need one big bill because they need to be able to entice the SALT provisions. Because if you remember, Elise Stefanik voted against a tax bill for the SALT provisions. Right. So they need as much as they can in one bill so that way they know it's a legislative priority. I don't believe you'll get much of anything until April at the soonest. And look, Trump's going to have to get involved very, very deeply in a way that he did at the end of the debt ceiling and the spending fight, but didn't at first. He needs to be in this in depth.
How do you see Democrats playing their hand in this? Is there anything that they are going to try to work with Republicans on, or are they going to basically try to be obstructionists?
Well, look, I do think that there is going to be some synergy around SALT taxes, for example, which are really important for a lot of Democratic members. But the reality is that Democrats are not going to get what they want. Their job is going to be to highlight the bad stuff so that the American people understand it. And you describe them as coalitions, not really coalitions, more like factions in the Republican Party. And we're seeing those play out. Many of those Freedom Caucus members, in fact, were not at the retreat. And I think that's a really key absence.
Interesting. Let's talk about the hearing today with RFK Jr. A lot of testy, heated exchanges. We just talked to Senator Lujan, who said he's leaning toward no. What were your big takeaways from the hearing today?
Well, it was really clear that RFK Jr. is way outside of the mainstream of healthcare policy, of science, and that was on full display today. He didn't seem to have a command of a lot of policy issues that are faced by the Department of Health and Human Services, and so it could give an out to a couple more Republican members to vote against him.
You know, Matt, there's the optics of these exchanges, and then there's the vote count. He can only afford to lose 3 votes, but we saw with Pete Hegseth, who was facing an uphill battle for defense secretary, in the end, he had the votes. Is it your assumption that in the end, RFK Jr. will have the votes?
Yes, because voting against a Republican nominee, if you're Susan Collins or Murkowski, the bank isn't endless. You get one, and they use one in Hegseth, obviously, maybe 2. You can't vote against everybody, right? So if you're Susan Collins, you're sitting there, you're thinking, I have maybe one more vote no. Do you want to use it on RFK, Tulsi? And again, might not make a difference at the end of the day as it did with Hegseth.
Yeah. So what do you make of that point, Kevin? Do you think that RFK Jr. is going to have the tougher time getting through, or Tulsi Gabbard? There are so many questions. And unfortunately, I only have 30 seconds left, but they're all for you.
I mean, thank you. No pressure. I mean, I would say keep an eye on folks like Senator Bill Cassidy, Senator McConnell as well, in no small part because of his own personal background and battle with polio, and then also, I mean, he has clearly concerns about Tulsi Gabbard as well. So if your model is correct and it's going to come down to which battles are you choosing, he's already given way on one, which didn't really have much of an impact because Senator Tillis didn't come along with him.
Yeah.
So does he pick one or the other?
All right. Well, we'll be watching. Thank you for a great conversation, Kevin, Donna, and Matt, and for being so quick. Kevin, appreciate it. We're back tomorrow with more Meet the Press Now, and we'll have live special coverage of the Senate confirmation hearing for FBI Director nominee Kash Patel and the Director of National Intelligence nominee Tulsi Gabbard. That's tomorrow morning right here on NBC News Now. The news continues with Hallie Jackson right now.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.